Thank you, Amy. We're going to hear now from Amy Katz.
Hi, and maybe you could also put up the slides since I'm going to be speaking to the beginning of the presentation. My name is Amy Katz. I had a whole introduction written for myself, but you're going to hear a lot from me over the next 15 minutes. So maybe I'll just explain that my role is I work at a research center called MAP at St. Michael's Hospital. I'm a knowledge translation specialist, and I'm also an adjunct professor at the School of Cities at U of T. And I'm happy to talk more about myself if anybody wants to hear it, but I think it'd be great so that we can start our presentation. If you could go to the next slide, we'll just give you a sense of how the next hour or so will go. Could we go to the next slide, please? Thank you. Yeah, so Amy and Amy are going to share the story of why we produced this checklist for community spaces. We think it's really important for you to have this context. Then Amy's going to come and share some highlights from the checklist. And then we're going to talk about what public health authorities, facilities, funders, and public health educators can do next. And then Pat will moderate a Q&A. Next slide, please. So this is our team. Most of us are here today, but presenting. But we wanted to give you a sense of how interdisciplinary it is. As was mentioned, we have law, we have engineering, we have epidemiology, we have knowledge translation, we have biomedicine. It's a really project management. And this is not even the full scope. We just wanted to give you a sense of that. And if we can go to the next slide, please. So we have many sources of support. One of the most important and foundational is from the School of Cities. We have a grant from the School of Cities, but it's not just that. We have support, for example, this webinar today. They've been incredibly flexible with this funding. We've had knowledge translation support, and we want you to know that we want the School of Cities to know that the whole team feels your commitment and feels your support. And this has been a really unique and positive experience for all of us. You've given us the opportunity to implement positive and material changes in the city, and we appreciate it more than we can say. And we hope that this will be a very long-term partnership. And we thank you. So next slide, please. Thank you. So before we get into the details of the checklist, we want to tell you the story of how we got here. So that takes us to 2021. And our team knows that Toronto Public Health and Public Health Ontario puts out guidance for congregate settings and long-term care homes. So when we say congregate settings, we're talking about settings like shelters, group homes, detention centers, and then we're also talking about long-term care homes. So we had a very simple question in 2021, does this guidance include indoor air quality measures like ventilation and filtration? So next slide, please. So before we tell you the answer to this question, we want to just make sure that we're all on the same page in terms of some shared facts, because these are the assumptions that we underpinned our research on, and we want to make sure we're all on the same page. So the first important fact is, by January 2021, it is known that COVID-19 is transmitted through the air. And as you can see here, this is published in July 2020, an open letter from 239 scientists from around the world that was published in Clinical Infectious Diseases, appealing to the medical community to address airborne transmission. And if you can go to the next slide, please. We tried to cram a lot on this slide, and we realize you can't read all of this, but just we can share this after, but these are public warnings in Ontario and nationally in Canada from engineers, from scientists, from physicians, literally begging public health authorities and others to address airborne transmission. And this starts in 2020, November 2020. And this is also peer-reviewed evidence, all before January 2021, demonstrating that COVID is transmitted through the air. So next slide, please. The next shared fact that we just want to make sure we're all on the same page about is that ventilation and filtration remove respiratory particles from the air, including, of course, infectious respiratory particles. This isn't news. I've seen Jeff quote Leviticus in some of his presentations. So again, these are not new technologies, but this is just a fact we want to help establish together. If you want to go to the next slide, please. Here you have guidance from the Public Health Agency of Canada, and it is emphasizing the role of ventilation in removing respiratory particles from the air. You can go to the next slide, please. Again, we tried to cram so much on this slide, and there's a lot we left out, but you get the idea. These are just a few examples of guidance released by engineers and indoor air quality experts starting in 2020, along with studies demonstrating the role of ventilation infiltration in removing respiratory particles from the air. You can go to the next slide, please. And I warn you, the next few slides are it's very upsetting, but it also, we're trying to lay out the stakes, and I think just to make it really clear. So I think this is intuitive. Settings where people are sharing a lot of spaces, bathrooms, bedrooms, eating spaces, they're going to be very high risk for COVID-19 infection. Next slide, please. This is data from, the first bullet is from Nora Loretto, who's an independent researcher who has an amazing database of deaths and outbreaks in congregate settings. And as you can see, by December 2021, some long-term care homes had lost more than 30% of their residents to the pandemic. The next two bullets are from PHO. And you can just see that not only were there enormous amount of deaths, and it's definitely an undercount for the workers because we know the occupational health data is not very good, but we know there was enormous amount of deaths at the beginning of the pandemic, but importantly, those deaths continue. Next slide, please. So as a group, we don't know of any systematic data that reports cases, outbreaks, and deaths per other types of setting, like for group homes, for example. But we'd love to hear about that if somebody has those data sets. But what we do know from journalists and academic and independent researchers is that the situation is not good. Next slide, please. This is an article from Nora Loretto and McLean's. It's about outbreaks in group homes in 2021. It's a very disturbing article, but I recommend that everybody read it. Next slide, please. These are some headlines about outbreaks in shelters and research about outbreaks in shelters. I think people know very well that this happened, but we just wanted to share some evidence. Next slide, please. This is from a group of independent researchers, academic researchers called the Prison Pandemic Partnership, talking about what's going on in prisons. Next slide, please. This is the last thing that we want to establish as a shared understanding before we move on to the actual data, what we found. And this is, I think, a really key point, that the health and safety measures recommended to congregate settings have particular implications for health equity in Ontario. If you can go to the next slide, please. So this is an edited quote. I hope you can read it. I don't know if it's big enough, but I'm going to imagine that it is. This is an edited quote from a paper we have submitted to a journal about the research we're about to show you. It's long, but we spent a lot of time as a group talking about how to frame this. So I'd like to give everyone a chance to read it from beginning to end. And each statement is heavily cited. We have a selected list of citations on the next slide. And just in case it's hard to read, which I kind of imagine it is, I want to say a few things about what's on the slide. First of all, none of this is new. And many people have firsthand knowledge of this. And to you, I apologize for stating the obvious. It shouldn't need saying, but unfortunately, this is not always made clear in public health. So the fact that power structures drive vulnerability and not populations, oh great, you can read it, I'm thrilled. Okay, is not always made clear in public health. In fact, it's actively obscured. There's a lot of fuzzy, mushy language, I think, as we all know, that obscures the role of institutions in generating illness and death. For example, you often hear about vulnerable populations. This needs to stop. It's a gloss. It obscures what's actually going on because it's interrelated, racist, ableist, ageist systems and the institutions that carry out their work that generate vulnerability. And that's what we want to emphasize here. So I'm just going to give you a minute to read this, and then we'll move on to the next slide. That's true. The word ageist is not in the slide, and it should be. Thank you for pointing that out. Okay, so we'll move on to the next slide now, please. So these are citations that support everything we said in the previous slide. They're a very short, selected group of citations, but we're happy to share those with people, along with additional literature. Okay, next slide, please. So I hope that we've clearly outlined the stakes that were involved in our research question. So we come back to this research question with this shared understanding. COVID-19 is transmitted through the air. Transmission can be mitigated by indoor air quality measures like ventilation and filtration, Congregate settings put workers and residents at high risk of infection, and all of this has very particular implications for health equity in Ontario. So we come back to the question, in 2021, did public health guidance in Ontario designed for congregate settings reflect evidence of the above? So next slide, please. No, I mean, it's not complicated. And we'll tell you how we got there. And we're sharing this in this, sorry, can we go back to no for a second? Because I have a few things to say here. We're sharing this in the spirit of how we can work with public health authorities to move forward today. But we think to do that, we need to go over what has already happened. So next slide, please. So, but now we find ourselves in the spring of 2021, and we're wondering as a group, what kind of public health guidance is going to places like shelters, and where congregate settings might learn about ventilation and filtration as infection prevention and control. So we started at the logical place, which is Toronto Public Health, and Toronto Public Health guidance at the time. We know people look to Toronto Public Health to guidance. We hear people for guidance. We hear people cite the fact that they're following Toronto Public Health guidance as evidence that a facility is safe, or as safe as it can be. So we looked at this toolkit from Toronto Public Health in May 2021. So as you can see, it's called the Congregate Living Settings Toolkit. It was put out in May 2021. It has links to a couple of dozen documents, and we reviewed all of those documents in detail. Next slide, please. So here's what we found. The resources listed in this toolkit provided almost no guidance related to ventilation, HVAC systems, portable air filtration, or ultraviolet disinfection. And most of those materials came from Public Health Ontario. We did contact several people at Toronto Public Health with their findings. We did not hear back. Toronto Public Health did eventually add a ventilation section to their COVID-19 guidance section for homelessness services and congregate settings webpage, which is really important. But a lot of outdated guidance remains there, including that original document, which is the first thing you see on that page. And although some of the documents it links to have been updated, many have not. So next slide, please. If you'd like to see our review, it's published on the St. Mike's website. The link is there, and we'll share that afterwards. Next slide, please. So since we noticed that most of the guidance highlighted by Toronto Public Health and other local public health units, importantly, came from Public Health Ontario, our next project was to review the online public written guidance provided by PHO for congregate settings and long-term care homes. Sorry, Public Health Ontario, I'm going to refer to them as PHO from now on. We did this in October 2021. Our findings are with the journal, and they're also have been submitted for publication, and they're available online as a preprint. This is an example of the type of document we looked at, and we picked this one specifically because it is still online, it is still live on their website, and it has not been updated and does not include any references to ventilation or filtration. Next slide, please. So in October 2021, we identified 11 public written guidance documents produced by Public Health Ontario on COVID-19 for long-term care homes and congregate settings. In them, as you can see, we found no references to any indoor air quality measures at the building level at all. We checked through our sample every few months after our initial analysis, and the first time we saw ventilation or filtration mentioned in any document in our sample was June 2022. Next slide. And I apologize, the slide is going to be a little bit upsetting. So Public Health Ontario produced these checklist documents that are intended to coordinate action. And you can tell because they have, boxes that you can tick off. They have a place you can put your name or signature. They have a notes section. And they produce these checklists around COVID-19 for long-term care homes and congregate settings. They also produce them for schools, summer camps, and clinical offices. So we compared the checklists, all of which were produced around the same time period. And what we found was, while there were no indoor air quality measures mentioned for congregate settings or long-term care homes, there were indoor air quality measures during the same period mentioned in the checklist for schools, summer camps, and clinical offices. So this was a very disturbing finding because we found that PHO was recommending indoor air quality in 2021 to some groups of people and not others. So everything that I'm saying right now is documented in our paper, which is a preprint, and I'm about to share a link to that. So you'll see all of the references, our methodology. This is all public, and we've also written about it in the conversation. Next slide, please. So as with Toronto Public Health, we contacted people at PHO starting in fall 2021. Again, we didn't get a lot of traction. And as I mentioned, it wasn't until June 2022 that there were changes to the public written guidance for PHO in our sample. Here's what was emphasized. And the reason we wanted to leave this slide up here for a minute is because this has been emphasized for more than 2 years. This is what people heard over and over and over. So even if there are small changes made to public health guidance online or separate documents, it's going to take a very systematic, very loud, very consistent process for people to understand that there has been a qualitative shift in guidance. Next slide, please. So here's where you can find our preprint. And again, we'll share this and all of our methods are there. There's also access to our data sets. And there's a plain language summary of our findings at the conversation as well. And this is my last slide, second last slide, slide 30. Next slide, please. So because we didn't get a lot of results trying to contact public health authorities, we started producing and sharing plain language materials. This was accompanied by webinars for different facilities in Toronto and Ontario. And we've had amazing community partners for this work throughout. Community spaces and coalitions are very aware of the importance of this information. Over the past year, we've had hundreds of people from facilities in the GTA and across Ontario attend our webinars, download our plain language material, and attend our virtual indoor air quality office program, which is the next slide, please. And my last slide, and something that we're very proud and excited about. So with this program, people working in community spaces have the opportunity to consult directly online with Jeff and Amy, who are two of the most knowledgeable indoor air quality and filtration experts there are, like period. We have a few spots left in 2022, and we'll circulate that flyer and we'll put a link in the chat as well. We've consulted with dozens of facilities to date, and the conversations we have at these consultations are confidential, but collectively, they really inform the guide we're about to share with you now. We heard the type of information people need. We learned a lot about how to share this information. We have also learned from office hours that many people have taken an amazing and enormous steps and done all kinds of independent research to keep workers, residents, themselves, and other people who use their spaces as safe as possible. It's incredibly inspiring. And they are coming to Amy and Jeff because they need someone to ask about the details of implementation or to sort through what is good information and what is misinformation. We also know that there are facilities that haven't done everything possible, not because they don't urgently want to keep people safe, but because they don't have the resources or because they followed public health guidance very carefully. And for many years, this guidance simply didn't include ventilation and filtration. So to all the people we've spoken to in the last year, we hope you see your amazing and beautiful influence in the checklist. We thank you for your incredibly hard work and inspiration. And now over to Amy to show you the actual checklist. Thank you.
Thank you, Amy. Like I have mentioned, I'm very excited to share this checklist with you. And I would like to start by talking a little bit about the design process of it. Amy has already mentioned some of it. So as we were discussing the findings of our reviews and the input from the office hours and webinars, our research partners, Pat and Lana, they suggested the idea of building a comprehensive plain language checklist for community spaces ourselves. So Amy Katz, Jeff Siegel, and I formed the team. Both Jeff and I have done extensive research into indoor air quality, and Amy Katz has been a knowledge translation specialist working with and for community organizations for over a decade. Next slide, please. Oh, sorry, could you go back? And as we have already mentioned many times in this presentation, the content here is very much informed by our conversations with the community organizations over the past year. And after we have created the initial draft, we ran it past 2 engineers for review, along with lay readers, including people who are very familiar with community spaces. And we got great input from all these reviews, and it's reflected in the checklist. So here, I would just like to say thank you again for everyone for their amazing and generous contributions. And we would also like to thank our graphic designer, Noel Nanton, for working with us to make sure this document is accessible. And we would like to hear any input from you on how we can further improve the accessibility of this document in future versions. And of course, we also want to thank Noel for making this checklist look so beautiful. For me, it almost feels like a brochure from an art gallery. Next slide, please. And now I want to talk more about the content of the checklist. So here on the slide, is the table of contents. Today, we're hoping to familiarize you with the basic categories and actions in the checklist and encourage you to share it far and wide. We welcome organizations, universities, and public health authorities to use it as a teaching tool and house it on your website. And we will revise it periodically. And if you let us know you're using it, we'll also make sure to share the most updated version with you. So here in the table of contents, you can see the different components of the document, with Chapter 4 providing a detailed checklist. We'll go through some of them in more details in the following slides. But first, I would like to highlight some of the key components from Chapter 4. You can see that we first focuses on the centralized HVAC system, especially on how and if your HVAC system is bringing you clean air. It is worth mentioning because even when your HVAC system is operating, it does not necessarily mean it's bringing fresh outdoor air or well-filtered indoor air all the time. And for this reason, we share key questions you can ask your building manager or HVAC contractor. And because not all of the buildings have four-star HVAC system, we also talk about when and how to use portable air cleaners with high-efficiency filters. And spoiler alert, you need to use it almost all the time and everywhere beside bathrooms. And then after that, we also talk about what to do with bathrooms. This is a rarely discussed, but very important topic. After that, we talk about when and how to use upper room UV systems, the important protocols like clearing the air between appointments and groups, and how to identify high-risk spaces. And at the end of the section, we also talk about how to avoid and address some of the problems that may come up when you're improving the indoor air in the facility. Next slide, please. So the next thing I would like to talk about is the best practice checklist in Chapter 2. When we were developing the format of this checklist, we had PHO's checklist document in mind because we hope this document could coordinate actions. We use this best practice checklist to provide a quick overview of the practices you want to have in place to improve indoor air quality and create a safe environment for everyone. This is the core information we would like to share with every facility manager, IPAC lead, public health inspector, and public health professional. From our experience, many people already have some of the information, and mostly by conducting their own research. But it is just more helpful to have a complete list of action items, and it helps to clarify any questions people may have. And we also provide more details on how to achieve each point in the following chapters. Next slide, please. And I also want to talk a little bit more about the first section of our detailed checklist in Chapter 4. This is focusing on the centralized HVAC system. So when we were designing this checklist, we tried to make sure that we're explaining things in a way that can be applied to how infection prevention and control work in real world in community spaces. For example, we learned from talking to community organizations that many of them do not own the space, so they are often negotiating with the landlords. And even if the organization owns the space, the worker in charge of IPAC may not have the opportunity to receive the training they would need to talk to an HVAC contractor. In addition, many workers are not getting the information they need from their employers. So to address all these challenges, we organized the HVAC system section, as you can see here on the slide, as a series of questions that an organization could ask their landlord, a person in charge of IPAC could ask an HVAC contractor, or a worker could ask an employer. And this slide also gives you a window into what the detailed checklist looks like throughout the document. Next slide, please. And as I have mentioned earlier, there is also a section at the end of Chapter 4 focusing on higher risk spaces and activities. And this is because from the conversations with the community organizations, we learned that sometimes it is not always obvious which spaces pose a higher risk. And here on the slide, I would like to make this very clear. It is not the people in the space who are high risk. It is the spaces and the activities. And we can improve the air quality and reduce the risk of these spaces once they are identified. So with the mask mandates gone, most public places are relatively high risk. So as you can see here on the slide, our first recommendation is to always wear high quality, well-fitted respirators like an N95 or a KN95. And once we have emphasized this point, we also talk about some of the other factors, such as the number of people in the space, the duration they're together, the size of the room, and also the activity level that could influence the risk level. This idea, the idea to create this section was suggested by someone who reviewed the guide and who works in community spaces. And we're very grateful for this suggestion. Next slide, please. And at the beginning of the document, there is also a chapter providing the context and definitions of some of the basic terms. We realize that many people are being forced to jump into the middle of indoor air quality discussions when the stakes are very high and without an opportunity to learn about the principles and definitions of ventilation, filtration, or airborne disease transmission. And of course, this is quite specialized knowledge, and the people are under enormous strain and need all the support and time they can get. So we hope that by sharing some of this information here today, we can provide a bit of support to help them navigate the questions and challenges so that they don't need to just spend a lot of time to conduct their own research and then try their best to keep themselves, other workers, residents, and visitors as safe as they can. Next slide, please. And finally, you can see there is a chapter in the document focuses on the communication with people in the space. We would like to emphasize that it is extremely important to be transparent about any indoor air quality measures you are using in the space with everyone. For example, if you're using a portable air cleaner, clearly communicate why it is needed, how to use it, and whom to talk to when there is a problem. For example, it could be that the portable air filter is not working, or maybe it's being too loud. We also share some tips to help the communication process. Next slide, please. Although I want to say that we are very proud of this checklist because it was produced with input with so many people who have been and are still working very hard to keep themselves and others safe in the community spaces. And we hope that you will use this checklist. Please post it on your website, use it for your classes, include it in your IPAC training, and please let us know if you have any questions or how we can further improve in the next edition. For public health authorities, we would love to work with you to honor and support people's work to keep themselves and their communities as safe as they can. Next slide, please. And at the end of the presentation, we would like to share the important next steps for public health and re-emphasize the importance of proper indoor air quality related information and guidance. It is very important to share information with facilities and workers directly, and we'll continue to do it. But it is not enough or systematic because we do not have the reach of public health authorities, and because people take public health guidance very seriously. So today, our team are asking the public health authorities here to take this up. From what we have learned from the hundreds of conversations over the past year through our online office hour, phone calls, and webinars, this information and guidance are much needed and less sick. Next slide, please. Now, here this final slide shows the web page housing the checklist. our office hour flyer, as Amy has mentioned, and some of the other resources. And now we would like to conclude the presentation and answer your questions. Thank you very much for listening.
Thank you so much, Amy and Amy. Really appreciate your presentation, the explanation of the materials, the questions that it has generated. And so what I'd like to do now is get to the Q&A portion of our session. So there were questions that were sent in advance. Thank you very much. And we are going to start with those. Some of you have also placed questions in the chat, and we'll be addressing those. And if you have questions, now that you've heard the whole presentation about our motivation as well as the checklist, please put them in the chat, and we are going to answer as many as we can. So we're going to ask our panelists and speakers to be concise in their answers, because we do want to answer as many questions as we possibly can. So let me start with the questions that were submitted in advance. So we've heard that public health authorities need to go through a systematic process to share the fact that IPAC guidance around COVID-19 has shifted substantially to include indoor air quality. And I'm wondering if Lana, maybe as an implementation scientist, if you could share a few words about the importance of a systematic process, especially when it comes to health, safety, and equity-related issues. Maybe you can share a few words about what that might look like.
Thank you, Patty. Thank you for that generally, and for directing it to me. When we think about a systematic approach, one of the things we often don't think about is what we need to stop and what we need to start. And so this is a great example when it comes to indoor air quality. We need to stop one set of guidance that is outdated and doesn't reflect the actual science. And we need to start a process that aligns with that scientific guidance and what is best for all people in terms of the precautionary principle. That said, that's where de-adoption science comes in. And so de-adoption is the process of ceasing a practice that does not have any known benefit, where there has been a change in the information available and it is no longer an appropriate practice to continue, or it is known to cause harm. And so what we know is that when we want to do a systematic process, we have to lay out the steps. De-adoption provides us with that. And it also is tied to quality assurance and quality improvement so that we can measure. And in terms of the implementation science part, that needs to be documented, it needs to be audited, it needs to be followed up, monitored, tracked, and reported ideally to an independent third party who has no conflict of interest. And so a systematic process identifies who all of the key players are, who all of the individuals who need to be protected, supported, or encouraged to get the work done, and to ensure that those resources that are necessary to do that are identified and appropriately provisioned in a timely manner. And that doesn't mean that you pick and choose. It means that you follow the guidance around what populations are at greatest exposure to whatever the contaminant is. And that is done systematically, meaning in an ordered fashion that is predetermined and that can be followed by anyone who wants to take a look and make sure that everything is as it should be. So a systematic approach requires de-adoption, it requires quality improvement and assurance metrics, it requires proper implementation science with adopting the new behavior, and most importantly, it must be monitored, tracked, and audited by an independent third party that has no conflict of interest.
Thanks so much, Lana. Okay, so our next question is that we've heard today that community spaces and communities are very aware that indoor air quality matters when it comes to COVID-19, but they don't always know where to start. So maybe I'll direct this to both Jeff and Amy, Amy Lee. If you could share one thing you wished all community spaces would do tomorrow to improve indoor air quality, what would that be and where can people start? And I actually have follow-up questions after that, but let's start with that.
Um, it's a great question and one that I wish I had a great answer to. But the answer I would give is, I mean, the checklist is a really great place to start. So engaging with the checklist. But I think a little bit more broadly, what I would say is that indoor air has been kind of in the shadows for so long that the decision to engage with it and to understand its importance and to improve it is really such an important first step. So we'll leave it there.
Great. Amy?
Well, like Jeff has mentioned, I think it's a great question with no easy or simple answer, because even right now, when I'm going through the checklist in my mind, I can think about maybe 10 items to talk about. And because there is a long list, I guess the first thing I would recommend community spaces to do is to identify the spaces with higher risk as a starting point. So if they have limited resources, they can dedicate to that space to improve the safety of that space first, and then start from there.
Great. Thank you very much. Okay, so let's see. Maybe I'll just open it up to the team, because so many of you have been talking to many community spaces about indoor air quality over the past 2 years, especially with the office hours option that you've created that are oversubscribed and so many have attended. What are the few things that you've heard that they need most in order to improve? Katz, maybe I'll start with you.
Okay, so I think money is obviously one of them, resources, capital funds to improve HVAC, and money for indoor portable air filters is a big one. I think a second one is official guidance that they can share with employers or landlords. We get asked that a lot. Well, how can we demonstrate to them that they have to do this? A lot of people know what needs to happen, but because that official public health guidance isn't there, they're sort of trying to make the case to keep themselves and their fellow workers safe, or to their landlords. Often these community spaces don't own the buildings, right? So these are the two things that we cannot provide. Part of the reason we created the checklist is so they at least have a document that's sort of co-signed by 5 different universities and a hospital that they can then share with people. But that's what we hear quite often. So I would say it's resources and official guidance. And also, yeah, I'm going to leave it at that. I'd like to hear what other people have to say.
Amy or Jeff? Amy Lee or Jeff?
Well, I think Amy K made a great point. And what I just want to add to is, even Amy Katz mentioned, is 2 things. One is the resources and one is the support from official guidance. But it is also just one thing, because without the support from official guidance, it is really hard to get the resources or to negotiate with the landlord to ensure the current HVAC system is working properly.
I would just add 2 very small pieces. The first one is that we need an initial resource commitment, but also an ongoing resource commitment. And I think that's important to explicitly call out. And then the second comment is that part of the issue is that indoor air is not recognized or valued. And a lot of that will come from government appropriately valuing its importance. And so that's the other thing that I think organizations need.
Thanks. And I think that relates to some of the questions that we got during the talk. For example, one question is, how do you explain why air quality measures are included for schools and clinical settings? So they seem to value it there, but not for long-term care and other congregate settings. Amy Katz, do you want to take that one on?
So we don't speculate as to motivation because we're researchers and we looked at the data. So I would actually like to understand that, but I don't think that we can answer the question. I think what we did do in our paper is look at what the legislation requires of Public Health Ontario, what the legislation requires of local public health units, what Ontario public health standards say in terms of equity. We looked at occupational health and safety legislation, so we can compare the actions of public health authorities to date to what their legislative requirements are in terms of why certain populations are getting better advice to keep themselves safe than others. Again, we're not going to speculate as to motivation. We're here to fix it. And but I do think that's a really important question. I think the second thing I want to say, to add to Lana's point, there needs to be a systematic de-adoption process. But it needs that's not an excuse for this to take forever. We offered a very clear roadmap for that a year ago in our review of the Toronto Public Health Guidance, and we're happy to revisit that with you. But this doesn't need to. This needs to start immediately. So again, we're not going to speculate as to motivation. I hope that I know that doesn't answer the question.
Thanks, Amy. You know, a related issue to some of the things already raised, both in the checklist and then in the responses to question, is this issue of needing money and cost. So there was a question about not only how much does it cost to implement these recommendations, you know, maybe our team could talk about the availability of some lower cost options. But, you know, I think there was also a comment about maybe the checklist needing to include preventative maintenance activities, but that would also cost money. So maybe somebody can take on the question about cost here. Jeff, would that be you?
I will do my best. So the frustrating answer is the cost really does depend, right? And it depends on the particular measure, but it depends even more on the building in question. In some cases, what's really needed is a substantial retrofit, which can be, you know, tens of thousands or even more. In other cases, you know, it's something much simpler. And so the comment I always make on the issue of cost is trying to address the whole problem perfectly right at the start is very challenging. And so there's lots of lower cost places to start. So some of the measures are very low cost. Where are people going? How are people scheduling? I think Amy Lee mentioned high-risk spaces and addressing, you know, some of the issues of scheduling of those high-risk spaces. All that type of thing is very low cost. It basically takes attention more than resources. And then, you know, you move into the realm of things like portable air cleaners. They certainly have a cost. I don't want to minimize that cost, but it's a much smaller number and perhaps an easier place to start for organizations. And I saw a question in the chat about do-it-yourself air purifiers, and they're surprisingly both effective and cost effective. And so I think, you know, the idea is, you know, layer on measures. The right answer is, of course, that the resources are available to do things right. But on the timescales we're talking about, you know, some of these lower cost things are appropriate places to start.
Thanks, Jeff. Anyone else on the panel? So there is a question in the chat about monitoring CO2 levels. The question is, could you comment more on CO2 monitoring, and should public buildings measure and share their CO2 measures, which I think is such an important question because these are the areas and the issues that we don't have enough data on, especially given the variation of buildings. So Amy Lee or Jeff, did you want to weigh in on this?
I'll try to answer this question. So again, this is a great question talking about monitoring, because this is a way to show how effective the ventilation of the building is. In the checklist, we also have a section talking specifically about CO2 monitoring and to what extent it could be helpful and what's the best approach to do it. But before we even talk about monitoring, I just want to mention that even without monitoring, there are already so many things we can do to improve the air quality of indoor spaces. And especially for a building with limited resource, I would always recommend to improve the centralized HVAC system if you have the access, or to use portable air filters as a first step before you take the carbon dioxide monitoring. And another reason is because if you're using filtration to lower the concentration of respiratory aerosols, then it's not going to show on the carbon dioxide monitoring. And in terms of public buildings reporting the carbon dioxide concentration, I think this would be a very helpful approach in the long term to ensure that the systems are working properly. But again, there are just so many nuances and complications related to the monitoring work, and it has to be done properly and done in the long term so that it can provide helpful information. Jeff, would you like to add anything?
No, it was a great answer. The only little piece I'd add is I think before we start indoor air quality monitoring, which in general I'm an advocate for, I think we really have to think through some of the privacy issues that arise. Monitoring indoor air reveals something about the people in the building and their activities. And I think we have to think through those issues and, as Amy said, do monitoring well.
Thanks, Jim.
Sorry,
Please.
Pat.
Yes,
I just
Amy,
want to relate back to the checklist. In the section I talked about related to communicate with people in the space. I used an example of using portable air filters, but in fact, we also talk about if you're using monitoring, make sure to communicate the measurement clearly with the people inside the space so that they won't panic when they're looking at the numbers. And if there is something wrong with the system, they can know who to talk to reflect this issue and get it fixed as soon as possible.
Thanks. So I wanted to build on the issue that you raised, Jeff, about privacy and monitoring and data. I think, we tend to think of data as being neutral and good and objective, but I think there are some members of our panel who know otherwise, that in fact, data are quite political. And maybe I'll ask Lana to kind of comment on this issue of data and, should we only be concerned about privacy? Should we be concerned about ownership? And how does this relate to equity? Because I think we're all here because we want to address equity, but we haven't had any questions come up about equity yet. So Lana, I'm going to put you on the spot maybe, and you can begin to address some of these things.
Thank you for that question. So I think it's important to kind of contextualize this. So when we talk about privacy, privacy is an individual right that is reserved exclusively for individuals and or incorporated bodies as per whatever contracts that they may hold. However, privacy is not actually the question or the matter here. The issue goes beyond individuals and includes collectives. So one of the reasons we have a constitution, we have Article 15, which lists out protected persons, is because we know that whole classes of individuals have their rights consistently undermined, and that's why they're named in Article 15. And so the issues that pertain to groups, and those groups are created as a result of societal exclusions and histories, is to ensure that they are protected. And so privacy does not address that matter of Article 15 and what happens to collective groups who are protected persons. And so privacy is actually a devolution of the legal protections that we are entitled to as folks that reside, live in, or are citizens of Canada. So I think it's very important when we talk about data to cease the discussion about privacy, because that actually is a device to ensure that, unfortunately, those who have been part of the colonization process, those who own the largest sets of assets and have control of political processes, that's who privacy serves, because they're individuals and the system skews towards those individuals. Peoples and individuals and groups protected by Article 15 don't have that level of support. That's why they're protected persons, and we have international agreements. So I think it's very important not to collapse privacy as the catch-all for everything. It's actually an incorrect approach and causes a violation of human rights. Number two, ownership of data. I think one of the things we have to understand is that while we are being told by corporations through slick marketing campaigns and excessive lobbying that has had its own effects on our own federal and provincial and regional governments, it's important to understand that individuals own their data because they are extensions of themselves. And that actually is a principle of law, even though it is increasingly being eroded. So in order to own one's data, we have to understand who ownership pertains to. And back to the first part of my answer, that when that includes protected persons, that includes a collective protection and right. And so ownership is a more complex. Another part of that question that's important to address that's tucked in is the ability to take care of and own and be a steward to your data. So the systems, do you have the computational systems? Do you have the firewalls? Do you have the IT support? And that does not become an excuse as to why an individual or a group cannot hold, own, or steward their data. But it is an important consideration. Often in the data discourse, we have this idea of ownership thrown around, but we never actually talk about what one is owning, what software you need, what expertise, and how much money you need in order to do that process. And what type of data are you generating? Do you need to be generating that type of data that would require that set of infrastructures? Or can you have low-tech data generation that allows all parties, regardless of their means, to have, quote, ownership or stewardship? And I point out to ownership and stewardship because we have principles when it comes to Indigenous peoples. And as many of you know, we have the decade of people of African descent, and there have been directions around that. And finally, the part of your question was privacy, ownership, and equity. With regards to equity, we're talking about equity as outlined in the Constitution. So equity is part of Article 15. So often in the context of the contemporary moment, people decide to create definitions for equity. That's not a thing. Equity is defined in the law. And given that we are dealing with settler laws, there is an entire body of law that's been established over 200 years in Europe and has been transported into Canada by virtue of our Constitution. So in terms of equity, that means to remediate. That means to restore, and typically that occurs through financial or other means. And so when we talk about that in this case, equity means making sure that the resources as well as the personnel are sustainably and timely made available. And so we can't claim to be talking about equity if all we have are words on a page and we don't actually have the funds in a timely manner with the personnel as described by the individuals who are in need of that. So for instance, if it is a shelter, they would receive the timely amount as directed by themselves or by individuals such as our team to identify what they would need, have that resources provided in a sustainable manner. So one is not trying to figure out what to do 3 months, 6 months, or a year down the road. Otherwise, any other use of equity is, I think the language is performative and has no bearance. And when we talk about indoor air quality, this is literally the essence of life, since in the West, we spend the vast majority of our times indoors. So I just wanted to share that. And I hope that answers your question thoroughly. If not, feel free to ask again.
Thank you, Lana. I think I'm going to put you on the spot for one more. So take a deep breath while I ask you this question. You know, it's about knowledge translation. I mean, we are doing this webinar because we want to make sure that our research has a strong knowledge translation component. And I'm just thinking about knowledge translation when communicating with policymakers and why, why that isn't more effective. How can we make our knowledge translation more effective? What do you see the barriers or some of the weaknesses with the knowledge translation and policymakers?
Ooh, I hope others will weigh in. I really do. So I'm going to take a crack at this, but I think Amy Katz should definitely follow in because she's a specialist. But from my perspective as an intervention scientist and implementation scientist, one of the things I want to offer before I cut to Amy is that when we think about policymakers, we think about who holds the power to make things happen, and not to think about that in the limited term of who is the person with the fancy description on the door, but to remember that we are part of a democratic process and that we can mobilize ourselves collectively to get that work done. And so often everyday people are left out of the policy arena. And we know that when it came to the outcomes of the pandemic, the public health guidance, which often was lacking when it came to communities who were not white, not affluent, and not made a priority, it was those communities and the friends of our communities that spoke up and caused shifts, change, and held off some of the most draconian aspects of the pandemic that were being foisted onto Ontarians and Canadians across the country. So I think it's important to understand that we have a collective power as individuals to identify what the policy issues are and identify who the policymakers are that need to be held to account and to use the mechanisms available to us. We may not always know what they are, but that's why we work collaboratively and transdisciplinarily, because there's different ways to come at this through the science, through legal means, through a host of means. And I'm going to leave it there because I'm just going to stick to the policy part. I'm going to leave the KTE part to Amy Katz.
Perfect. Over to you, Amy Katz.
I mean, like, I don't know. We've been trying to communicate this for like over a year, right? We've written directly to policymakers. We've written opinion pieces. We've had a zillion webinars. This is another attempt, right? We know there's a lot of people from public health here. We thought maybe if we spoke about this in a public arena in front of everybody's peers and tied this checklist to, you know, very concrete changes we want to see from public health, that's another attempt. We're also working, I talked a bit about the legislation. We're looking at legal and regulatory solutions. So I think I think there's this idea that you have really good evidence in KT and then you share it and then something happens. That is, in my experience, rarely the case, and especially rarely the case when you're talking about something that's trying to shift the status quo. The status quo has been not just not talking about ventilation and filtration, but the status quo of colonization, white supremacy, and racism, which means that these like facilities such as shelters are going to get worse guidance than facilities such as summer camps. That's not a surprise. Again, I said I'm not going to speculate as to motivation, but it's of a piece with what is going on here in this geography. So I think, how do you address those kind of systems through knowledge translation? I don't know, and I don't pretend to know, but we're going at this from multiple angles, and I see this as a project of mitigation at best. I don't know if that answers your question, Pat.
Yeah, maybe I'll just add on a small piece, and that is, you know, you or our team has seen so many of these community organizations come out. They're willing to spend the time, energy, and effort to find out information, find out strategies to improve their places. That energy could have happened maybe earlier on in the pandemic through formal partnerships with an organization like PHO, so that PHO could be more tuned in to what the needs are of these organizations in this sector. So maybe partnerships is a way to go. Are you raising your hand, Lana? Go for it.
Yeah, you said something that sparked a piece that we talked about some time ago. And so when we think about partnerships with PHO, the legislation was brought forward. I was around during H1N1. I almost got stuck in one city because I was trying to get back to my home city because they were going to shut down GO Transit. I also was present and participated in a number of the dialogues, discussions, and plannings for pandemic preparedness. And we said way back then, and I was on the front lines, like, what you guys are doing does not reflect the real world or real life. And why are all you suits doing this when you don't actually live and work in these places? You don't live, work, or play in these spaces that you're claiming to want to regulate or assist. And so I think part of the challenge with policy is, are the right people in the right place doing the right job? Because often, even with institutions and legislation, there's a way in which the folks that get to do the talking aren't the people that have to live with the consequences. And the folks that live with the consequences need to be the ones to evaluate whatever is put out and identify where there's a potential fail and address that in advance. And we do this in business, and we do this in engineering. We do this in almost every sector when there is a plan around an urgent or an emergency matter. I do emergency preparedness evaluations and audits, and this is a requirement. So this is not news. So I think part of that piece of partnership and the legislation we currently have requires folks to come to the table and understand and be reminded of their responsibilities. And I say that is something that we, the people, must do because we've already seen in action. And we know that this is tied to political processes. So we don't need to speculate. The evidence has been here for 500 years. Note that that has a timing. Because prior to that, the documentation on indoor air quality was pretty good, as described by the archival records. And so I do want to point out that who is making the decisions are often not those who live with the consequences. And that needs to be the site at which things are audited before they're put into motion. And I don't think we would have seen this problem. And I don't think we would have the problem we have now, which is we know that community organizations are doing with shoestring budgets, amazing protections that are the responsibility of a well-resourced, well-heeled PHO who has engaged in multi-million-dollar no-compete contracts, but has designated no resources to the very people that they have marked and who have been harassed and pressed into places by police and who have resisted becoming victims of outbreaks. So I think we need to make the connection between all that Twitter activity we saw as people volunteered to do carpentry, to build safe spaces, to avoid the poor indoor air quality. And what did we have? We had a city that wanted to fine him. And without, again, the resistance of the masses, someone that was doing the right thing would have been harmed. So I want to make sure that we keep the context of the reality always at play here, and that there are politics that have little to do with health on the table.
Thank you so much, Lana. Okay, I know we're running out of time, but I want to give the last opportunity for comments and final thoughts about indoor air quality to Amy Lee and Jeff. So do you want to share some final thoughts with us?
So it's a really tall order, but I do want to comment that 2 years ago, 5 years ago, 10 years ago, I couldn't have imagined this event happening, right? There just wasn't the interest in indoor air. And so I think it's important, despite there's a lot of kind of systematic things that are very wrong, that's almost hard to see how to correct. I do want to say that there is the fact that this has even happened should be taken as encouragement, and it's obviously not an end point. It's a beginning point, but I'm very optimistic that indoor air, and specifically indoor air in community settings, will get the attention that it deserves.
Thanks, Jeff. Amy Lee?
Oh, thanks, Jack. Great point. It's really hard for me to just recommend one thing or maybe mention one thing, because I have so many different things in my mind. Again, it's a great opportunity for me to participate on this project, and it is great that we're having the discussion here today for community spaces. But like I have mentioned at the beginning of this webinar, COVID-19 is important, and stop the transmission in all spaces is very important. But this should not be the only focus to improve indoor air quality. We should also, it is for the health and well-being of people living inside the space. And I know right now there is the argument if COVID-19 is over or not. I don't want to comment on that in this event, but there are also other respiratory infectious illness. And just in general, improving the indoor air quality has so many benefits. So I hope we can have this attention, have this interest ongoing in the future.
Thank you so much. Okay, so I think we've come to the end of our time, and I'm going to hand it over to Brenna.
Thank you so much, Pat, and thank you to our speakers and our attendees today on behalf of the School of Cities. It was a really fantastic presentation, and I think provided a lot of really grounded information for all of us on this topic. I'd also like to invite all of you to our next session, which will feature a discussion with Lynette Ong, and that session is entitled Outsourcing, Repression, and Everyday State Power, China's Urbanization and Comparative Perspective. And that session is going to be taking place next Wednesday, October 26th at the same time, 12 p.m. Eastern Time. And to register, please visit the School of Cities website. And yeah, thank you everyone for joining us today, and have a fantastic day.